Hello, everybody. Last week I spoke to you about teething babies and what they go through and what you can do to soothe their gums and what toys would be good for them to have so they can relieve their own soreness. I'm still going to be talking about teething babies, just a different topic, and add on to last week's information. So I've heard about babies being born with teeth. It's pretty scary. Well, not really scary. It's kind of weird to think of a baby born with a teeth. But I actually did some research, and one in 2,000 to every 3,000 births, a baby is born with a tooth or so. And these teeth are called natal teeth, which is different from neonatal teeth, which grow within 30 days of them being alive. Usually when babies are born with a tooth, doctors usually want to pull them out due to them being already loose, or if you are breastfeeding, that's no walk in the park. They can actually bite you, or it can get in the way of them breastfeeding because they can't really grasp of sucking having a tooth. They're not used to sucking in the first place. So having a tooth in the way can hinder of their getting their nutrition. Another thing is having teeth can actually be very complicated to the mother and to the baby, him or herself, due to the mother has to get a damp cloth every day and clean the tooth to make sure it doesn't get infected, or make sure that everything is going well with the baby. Another thing is, which is very harmful for the baby, is that your baby can actually cut himself with the tooth on like the tongue, and which is very accurate. My baby, his two teeth had just cut in this month. He's 6 months, and he had a cut on his tongue, and it kind of looked very hurtful. And I took him to the doctor and for a 6-month checkup, and I mean everything is fine. It's just he was just in pain for a little bit. Babies tend to start teething around 3 months to 12 months old, and usually the baby's teeth cut in between 6 to 7 months. Sometimes babies' teeth can cut in at 12 months, depending on how their teeth want to come in. It varies from baby to baby, and you can give them teething tablets, which they're little round tablets that dissolve underneath the tongue, or baby Orajel. You also heard of the wives' tales and all that, rub the whiskey or rum on the gums itself, but I guess it's up to the mother herself of what she wants to do. Another thing is, if worse comes to worse with my baby, I give him some Tylenol, and that seems to soothe it for a little bit, and he seems to be better off when going to bed. Other than that, like teething, it's just a horrible experience to go through because no parent wants to see their baby go through so much pain. There's not much they can do. Also, another main thing is when they teeth, they tend to drool so much that they can develop a rash on their chin and sometimes on their neck if they're chunky and the saliva just goes down, and they can develop that rash there. And usually you always want to keep dried clothes on him or her. It's very hard to keep while they're teething, but I guess you can do the best you can do. Other than that, that's all I have for teething for this week, so I hope I'm not boring you guys. Alright, talk to you guys later. Bye.